Okay, let's invite Mr. Heng. Mr. Heng, you may start.
Okay, thank you, Kim Dong. Good afternoon, everybody. Yeah, today we are going to talk about this issue 81. The research that featured here is on Lingzhi Polysaccharides have anti-brain tumor effects. Okay, go to introduction, Kim Dong. Yeah, introduction. Yeah, okay. Right, malignant glioma. Okay, also maybe when it's malignant, the name is called glioblastoma. It's the most common type of brain cancer. Despite current multimodal treatment, I mean, that means as usual, cancer treatment is always surgery, radiation, chemo. Prognosis for the patient has always been poor. Not able to recover much. Okay, the average survival of this glioblastoma patient are usually 2 years or less than that. Average is about 14 months if I'm not wrong. And survival is only 27% for 2 years. And anything that is beyond 5 years, survival is only 5%. Okay, so this low survival rate can be associated to the barrier in us human having this blood-brain barrier, triple B, that prevents medication from reaching the brain cells through the blood. So in a sense, when it comes to treatment, there is a problem because a lot of treatment have to go through the blood to reach the brain. All right. Okay, next page. Right. So of course, naturally, one way to go about to treat this brain cancer is to try to approach through the immune function of the patient. Okay, and as such, this area of research has been the focus of the medical field in the last few years. Okay, as you know, Lingzhi has been known for thousands of years, and they have this immune modulation and anti-cancer properties. Okay, it's been widely used to promote health and longevity, right? And plus treatment of various type of diseases like bronchitis, triple high, hepatitis, nephrititis, and cancer and liver problem, all that. Okay. So in view of this triple B blood-brain barrier, researchers like to explore whether Lingzhi can help in this glioma, okay, in this brain cancer through its various biological activities, the various biological activities of Lingzhi, okay, that include immune modulation, anti-tumorigenicity, that means preventing tumor growth, antioxidation and anti-inflammation. Okay, right. This researcher were from next one. The researcher are from China, C.H. Wang. She is from Fujian Medical University Union Hospital in China. He and his team produced this paper, Anti-Tumor Immunomodulatory Activities of Ganoderma lucidum polysaccharide in glioma-bearing rats. All right, and they explore the effects of Lingzhi against glioma-bearing rats. Right, and found that polysaccharide extracted from Lingzhi can inhibit the growth of glioma cells and prolong the lives of the glioma-bearing rats. The test subject their paper were published in the Integrative Cancer Therapies in September 2018. Okay. Okay, before we continue to talk about the paper, let's understand a little bit about glioma. Okay, glioma is basically a type of tumor that starts in the glia cells of the brain or spine. This glia cells is actually a layer of coating around the nerve cells to enhance nerve cell communication and signaling between one another. Okay, and normally these glioma tumors are classified into 4 types, 4 grades. Grade 1 is asymptomatic and it grows very slowly. So if people who is so-called have grade 1 and they go and see doctor, the doctor will say, okay, we'll wait and see, we'll not do anything and see whether it grow or not. Okay, no need to worry about it. Okay, then they'll just ask you to come back next year and see how it goes. So grade 2, then they will, it will still be considered benign and still growing slowly, but you'll start to feel a little bit of effects on your brain, and like maybe you'll be a bit giddy lah, a bit hearing problem lah, you know, it affects the part of the brain that it press on. Okay, same thing, the doctor will still say we'll monitor, we'll not do anything. If of course if it is has low risk, then there will be some surgery. The doctor may recommend surgery plus some radiation. But talking about this, I remember one of my colleague who has a client also have something like that. Then the doctor say, oh, the risk is only 15%, you know. After he go into the surgery, 3 weeks later, mati lah. Okay, right, okay, that's beside the point, all right? Okay, now come to grade 3. Grade 3, now is considered malignant, all right? Okay, and then name may change to glioblastoma lah, because it's already a cancer. Actually, grade 3, grade 4 is the same, glioblastoma. Become very aggressive. We need aggressive treatment, and average survival is usually around 14 months, that's all. Okay, right. So that's about it lah. We don't talk so much about glioma, but just a little bit of understanding. Next one. Okay, the blood-brain barrier that I spoke about just now. All right, the blood-brain barrier is basically a layer of specialized endothelial cells along the walls of the capillaries around the brains. They allow only some substances carried by the blood to pass through the brain. Although it is said to be a barrier, but it's not actually, there's no such thing as like a net out there completely blocking it up. You know? It is just that the wall of the blood vessel being a bit tighter. So only certain special thing can go through. It's nothing, if you open up the brain, you don't see a particular barrier as it is. It is just the walls of the blood vessel, or in this case, because it's so tiny, it's called capillaries. It's so tight that they only allow certain things. Okay, the purpose of all this, triple B, is to protect the brain cell from any toxin and pathogens that circulate in the blood that may cause infection in the brain. Okay, this is our natural way to protect ourselves lah. Then only nutrients like water lah, oxygen lah, that need be new to so-called support our brain cells can pass through. Glucose lah, lipid soluble substances can pass through this endothelial cell, the wall of the capillary, and into the brain cells to nourish the cells. Okay, But however, antibiotics and drugs, all this are being kept out because they are not the usual. They are, maybe you want to say in medical term, a little bit bigger in item, too big to cross through. So, however, of course, this triple B can be compromised if a person has neurological situation, such like epilepsy, brain trauma, liver failure, or meningitis. Then it just all war break loose. Oh, okay. Open up. Next one. Okay. Let's look at the research improper. First, we look at the materials and methods. Here they use this male fisher rats. Why they use this? This is particular, maybe one that is more lively and more natural. And they inoculate these RG2 glioma cells. These RG2 glioma cells maybe is a cells that is cultivated from human glioma and then has been cultivated in the rats. So that's why they signify as RG2 glioma cells to a depth of 3 mm relative to the dural surface on the right side of the head. But the dural surface is just like slightly below the inside below the skull, under the skull, 3 mm. Okay, of course they have to open up the skull, then they inject it in. Then after that they close it up. Okay. Lingzhi polysaccharide extracted, like what we also do from the fruiting bodies of Ganoderma lucidum, and injected intraperitoneally into the rats. That means abdomen injection, abdomen injection, because the rats, you feed them, bitter, maybe they may not, I don't know. Right, so it's easier to inject them by through the abdomen. It's easier to control the quantity, the amount. Then, okay, then of course the rats that have been injected with glioma cells are then divided into 4 groups. Okay, one group is called control, where they don't inject them with polysaccharide, but with normal saline. Okay, group 2, group 3, group 4 are injected with polysaccharide of different quantity, 50, 100, 200 milligram per kilo. Okay, then after 2 weeks, they do an MRI scan of the brain. And day after that, they leave the rats. Of course, they have to feed them to continue to live and see how long they live. Okay, next one. Okay, then let's look at the result. All right, so after 2 weeks, the result shown that the tumor size of the Lingzhi polysaccharide 50 and 100 milligrams group was only 2/3 of the control. You see the chart on the right. Maybe the A diagram might not be so easy for us to see. Okay, but if you look at the B diagram, you see the control is 150, the size of the tumor, okay, tumor volume, whereas the 50 and 100 is around 100, whereas the 200 is the same as the control. Okay, all right. So you can see that the more effective one are the 50 and the 100 milligram. They are 2/3 the size. And then the average survival period of these two groups, 50 and 100, was longer than the control. The average survival period of the control was only 24 days, whereas the average survival of the 50 and 100 is 32 days. That is 1/3 more. Okay, I mean, let's say if somebody can live up to 60, then 1/3 more will be 80 lah. Correct or not? So they cannot explain why the 200 milligram did not display as much effect as the 50 and 100, but probably because maybe the high dosage might have caused an initial increase in tumor burden. Just like we always say, maybe there is an initial response of the Lingzhi, because this experiment only for 2 weeks, right? Maybe a prolonged period of consumption may give a different answer. We don't know. That has to be seen. Okay, next one. Okay, after they have seen the result that Lingzhi polysaccharide can reduce the size, tumor size, and prolong life. That means tumor, the first term on tumor, what is that? Tumor, anti-tumor genicity. Genicity, that means tumor growth is there. All right, that means polysaccharide has prevented a tumor from growing bigger. All right, the next thing is they want to look at the immune system. All right, so they explore the immune function of the rats that are being implanted with glioma cells. Okay, they find out that the CD8 plus T cells, which is, to us, simple term, we just simply call natural killer T cells. Right? If you look on the screen on the right, it is all the brown dots. You see the control one has a very small patch, whereas the 50, the 100, and the 200 has a lot, right? So it goes to show that the CD8 plus, or the natural killer T cells of the glioma-bearing rats are higher if they have been treated with polysaccharide, right? And the fact is, when there is a presence of CD8 plus T cell, in a more scientific term is cytotoxic T lymphocyte, has been associated with a better prognosis of the disease. Okay, so here it is. It proved that Lingzhi polysaccharide has an effect in improving the immune system of the patient. Okay, next one. Right. Then of course, we only the previous slide only show about CD8 plus T cells, which is a natural killer T cells. They also next look at what is in the blood serum, okay, to prove that that is the case. So they look at these 3 items, which is related to immune function. Interleukin-2, which is responsible for activating and stimulating the growth and maturation of T cells and B cells. And they look at the tumor necrosis factor alpha. This is an inflammatory cytokine responsible for cell signaling that will cause the cell to die off by itself. Okay. And interferon gamma, so-called interferon gamma, which enhance antigen presentation and regulate Th1 and Th2 balance. This Th1 and Th2 balance, if it is not regulated properly, it will end up with an autoimmune problem. Okay, so the result of their test of the serum, they find that these 3 cytokines in the blood serum of the glioma-bearing rats were higher for the Lingzhi polysaccharide group than the control. So naturally, the conclusion the researcher reached is that Lingzhi polysaccharide can enhance the immune and anti-responses of the body. So this explain is one of its anti-tumor mechanism. All right, next one. Okay, the spleen is also spleen. In Chinese we call 脾脏. is an important organ in the immune system. I mean, of course, sometimes people with enlarged spleen, they remove it. They say, okay, no problem, you can still function without the spleen because your immune system can be taken over by other part of the body. But definitely, when your spleen is not there, it's definitely not healthy. Okay, so spleen is a place that where it controls the level of the blood cells. It recycle all the blood cells, the good cells, they will recycle it, the bad blood cell, the platelet, all that, they will recycle it. The bad one, they will remove it. Maybe it's one area then that probably can reduce your free radicals. I don't know much about it, but this is one area, because once it cleans your blood, it recycle your blood, remove all the dead cells, all the dead blood cells, has something to do with that. Okay, then also it is one area where it helps to create antibodies. Okay, now then the study also find out that Lingzhi Polysaccharide can significantly increase the lymphocyte in so-called the proliferation rates of the lymphocyte in the spleen of the glioma bearing rats. This lymphocyte that is able to proliferate include T cells and B cells, which are part of the very critical immune system. Okay, I mean, that's why you also remember the last time we talked about Lingzhi helping improving our immune system to fight against COVID-19. Why? This is also one area that it can help to speed up our system, our immune system, and to help us protect our body. So as it is here, it enhances cellular immunity and improve the immune system. Okay, next one. Right. Of course, that was those were in vivo study, right? The researcher want to know how it actually works. So they did an in vitro study, that means outside on a cell, on a dish cell. They found that the natural killer cell can actually kill the glioma cell 1-to-1. Okay, so the immune system that has been able to generate, to proliferate the CD8 plus cytotoxic T cells being created, or rather being increased in production with the help of polysaccharide, can help to kill the glioma cells, and as a result, reduce these glioma cells cancer, and of course improve the chances of the patient by controlling this cancer from growing. Then they also noticed that Lingzhi Polysaccharide increase the maturation and activation of dendritic cells. This dendritic cell is one of the immune, one of the white blood cell in the innate immune system, the first level, right? They identify any pathogen, any foreign element that comes into our body. Straight away they identify, they will have their natural killer cell to kill it. If not, they will inform all our T cells and B cells to produce more killer cells to kill the foreign element. Okay, that's why you have that's why I said that earlier. This also, the enhancing of the immune system also can help us in our COVID-19, because why? Our Lingzhi Polysaccharide can have an early early activation of the immune system and let them mature faster so that they can produce and recognize the foreign element earlier and attack them before they become a mess in our body. Okay, next one. Okay, so we come to a conclusion. The study show that despite the triple brain barrier preventing substances from reaching the brain, Lingzhi polysaccharide or Ganoderma lucidum polysaccharide can achieve its anti-tumor effects indirectly through the immune system, through the immune cells into the blood and go into the body and inhibit the growth of glioma cells and prolong lives. Okay, the study also show that appropriate volume of polysaccharide can have anti-tumor effects, although not necessarily the higher the better. But like I said just now, maybe it could be that this experiment is only for 2 weeks, right? If it is for a longer period, maybe it might be a different story, but that has to be explored further. However, the result of this research have at least reviewed that the possibility of Lingzhi polysaccharide against brain cancer can give the patient a chance of hope and may worth a try in the current situation of a stretch treatment where they already stretched to the limit and then there's similar like their survival is only within the short time. Hopefully with this Lingzhi polysaccharide, they can prolong and improve their survival time. Okay, thank you. That's all I have. Bye-bye.